Welcome to Cupping Dynamics informational videos. Today we're going to talk about preparation for fire cupping. In order to offer fire cupping, you need to make sure you have all the essentials necessary to get started. So make sure you have a clean working environment. Your space needs to be sanitized and ready to go. You need to have the following: alcohol, 91% in a pump dispenser or 70% in a nice sealed container. You want to make sure to have cotton balls, a hemostat, an extra towel to dab excess alcohol, all the necessary cups that you need. You'll want to make sure to have a flame. I prefer to use a candle or to make sure to have a lighter handy. You also want to make sure to have an area or place to extinguish cotton balls. So after you blow out your flame, you want to make sure to have a receptacle. I like to have a little bit of the water in the bottom to get rid of any excess smoke. And lastly, you need to have an area to put your dirty cups. So some form of a receptacle separate from your clean working environment to set all of your dirty cups. Once you have all of this prepared and ready to go, you can start your fire cupping. Welcome to Cupping Dynamics informational video. Today we're going to talk about safety and precautions. In order to offer fire cupping with your client, it's very important that you have a mental checklist of all the safeties and precautions you need to get started. First, explain the procedure to your client and make sure to get their permission. Make sure they don't have any allergic reaction to oils, lubricants, or analgesics that you may be using on their skin. Make sure to also explain that soreness, fatigue, itching, and potential skin sensitivity could be a symptom after. Make sure that they know that within about 48 to 72 hours to keep those cup marks covered at all times. Also very important with the procedure is when you have a flame, first dunking your cotton ball in alcohol, make sure to dab any excess oil on a towel nearby. This will help to avoid any dripping of alcohol. Once you light your cotton ball, please make sure to be aware of the flame and make sure to keep it away from any flammable products, including hair products or clothing on your client. Also make sure with the flame that you do not burn the rim or create too much heat on the rim of the cup. In order to do this, it's nice to place the cup at an angle downward so when you place your flame in, it doesn't come in and around. You want to avoid this with the rim of your cup. Lastly, make sure that you don't slam the cup down hard on the client. By pressing on the cup, it's not going to increase any suction. So bring the cup down, place the flame in, and set it gently on your client. Make sure, once that cup is in place, that you extinguish the flame of your cotton ball. Very important to extinguish the flame by blowing on the cotton ball. Make sure the flame is out. Once that flame is out, place in the receptacle with your water so that there's no excess smoke. Set your hemostats down, and now you're ready to begin. So always make sure that you have that safety and precaution checklist in your head before you're ready to go. Welcome to Cupping Dynamics informational video. Today we're going to talk about technique for fire cupping. Now that you have your station prepared and your mental checklist of all your safety and precautions, we're ready to get started. Technique. As a reminder, make sure to dunk the cotton ball in the alcohol or using your pump set, but you don't need too much excess alcohol, so it's about half of the cotton ball. Dab any excess alcohol on the towel provided. Light your cotton ball and know that this is about the flame size that you want. Not too much higher and certainly not much less. Make sure to have your cup ready. Place your palm of your hand face up with a slight tilt downward in the cup. Again, this avoids any flame wrapping around the rim and creating heat. We have 3 different levels of suction: light, medium, and strong. For a light, it's a count of 5, meaning 2 counts inside the cup and a 1, 2, 3 count outside. Let me demonstrate. Placing the palm of the hand face up with the cup slightly tilted down, it's going to be a count of 5 for a light suction. 1, 2, 3, 4, 5. Again, don't slam the cup down hard on the body. The cup will then have a very light movement to it. This is best for sensitive clients, elderly clients, and children. The lighter the suction, the easier to move along the skin. Next is going to be for a medium suction. A medium suction is going to have a little bit more depth to it and it's going to be a little more difficult to move. So after you light your cotton ball, for a medium suction, it's going to be a 4 count. So light was a 5 count, creating more space for oxygen to get back into the cup. Medium is going to be a 4 count. Place your hand close to the body, palm facing up. Cup slightly angled down. Your 2 count is inside the cup and 2 count outside. Let me demonstrate. 1, 2, 3, 4. With the cup at a medium suction, you'll notice more skin and tissue is raised up into the cup. That medium suction is also going to be a little more difficult to move. You'll notice where there's area of bound, stuck, or stagnated tissue and fluid, that cup might feel a little stickier or harder to move. Usually a good indication of where to leave that cup. Next, we'll do a hard suction. Again, make sure not to get too much alcohol on your cotton ball and to dab any excess, also making sure your hemostat is locked in place. For your hard suction, make sure, again, palm facing up, cup angled down. You want to have a count of 3. So a hard suction is going to be the deepest suction or the most depth of suction you can get. So it's going to be a very quick movement, so less oxygen gets in the cup. The count of 2 is in the cup and the count outside is only 1. 1, 2, 3. You'll notice with this has the most amount of skin and tissue placed up under the cup. With a hard suction, this may be sensitive to your client to do a lot of movement. So always very important to check in with them and keep communication opened. You will also notice that this is very difficult to move from one place to another. So let's review that. A light suction is a count of 5. 1, 2 in the cup, 3, 4, 5 outside. A medium suction is going to be a 4 count, meaning 1, 2 inside the cup and 3, 4 outside. Strong suction is going to be a 3 count, 2 inside the cup, 1 outside. It's a very quick movement. Once you have all 3 of those suctions and you can identify with those, keeping communication with your client is very important. Once the cups are on and you're done with the procedure, to release the suction, don't just pull on the cup. Make sure to place 1 finger underneath, lightly letting out the oxygen to remove the cup. Placing your cup in the dirty receptacle away from your sanitized space. Again, making sure to communicate any potential symptoms that may follow cupping, such as itching, skin sensitivity, soreness, or fatigue. Check in with your client, make sure they're feeling okay, and let them know about possible redness or red marks left after the treatment. Now that you've practiced your technique, you're ready to go. So now you have all three suctions. You have your light suction, easier to move, your medium suction, movable but going to be a little bit more depth in that suction, and then your strong or hard suction. This you want to check in with your client before you actually do any movement on the tissue so that to create no skin sensitivity. Once you have all of these specific suctions, to remove the cup, it's always best to place one finger underneath the lip of the cup, pressing down on the skin and the tissue to release the suction of the cup. Don't just pull up on the cup. Make sure to place your dirty cup in a receptacle away from your sanitized space. Don't forget to communicate with your client about potential redness or marking from the cup from blood brought to the surface of the skin. Also make sure to let them know that there's the possibility of itching, skin sensitivity, soreness, and fatigue. Remind them the importance of keeping cup marks covered due to open pores and skin sensitivity for at least 48 to 72 hours, especially avoiding exposure to wind and sun. Now that you have your technique down, I encourage you to practice and get started with your fire cupping. For more information on fire cupping and upcoming workshops, please visit actiondynamics.org/info. Thank you.